Question 1. A nurse is caring for a patient post-total vaginal hysterectomy. Which finding is most concerning? A. Small amount of pink drainage. B. Complaint of sore throat. C. Decreased urine output. D. Pain rated 4 out of 10. Answer: C. Decreased urine output. Question 2. Which task can the RN safely delegate to the UAP caring for a patient post-gynecologic laparotomy? A. Monitoring for bleeding. B. Assisting with ambulation. C. Reinforcing discharge education. D. Administering oral pain meds. Answer: B. Assisting with ambulation. Question 3. Which symptom in a patient taking hormonal therapy for menopause should be reported immediately? A. Breast tenderness. B. Nausea in the morning. C. Calf pain with swelling. D. Mild weight gain. Answer: C. Calf pain with swelling. Question 4. A patient recovering from a myomectomy is requesting food. Which order should the nurse verify first? A. Regular diet. B. NPO until bowel sounds return. C. Clear liquid diet. D. Full liquid diet. Answer: B. NPO until bowel sounds return. Question 5. A patient with cervical cancer is receiving internal radiation. What is the nurse's top priority? A. Encourage high-fiber diet. B. Monitor for fatigue. C. Limit staff exposure time. D. Provide emotional support. Answer: C. Limit staff exposure time. Question 6. What is the priority nursing action for a patient reporting lower abdominal pain and fever post-IUD insertion? A. Reassure the patient it's normal. B. Apply warm compress. C. Assess for PID and notify provider. D. Administer antiemetics. Answer: C. Assess for PID and notify provider. Question 7. A patient post-op for ovarian cyst removal is dizzy upon standing. What is the best initial nursing action? A. Elevate the legs. B. Notify the surgeon. C. Assist the patient back to bed. D. Encourage more fluids. Answer: C. Assist the patient back to bed. Question 8. What is the best response when a patient asks, "Why do I need a pap smear if I feel fine?" A. It's optional if you have no symptoms. B. It detects early signs of cervical cancer. C. Your doctor ordered it for hormonal changes. D. It checks for vaginal infections. Answer: B. It detects early signs of cervical cancer. Question 9. A nurse is caring for a patient with suspected endometrial cancer. Which symptom supports this suspicion? A. Heavy postmenopausal bleeding. B. Vaginal dryness. C. Pelvic pain during ovulation. D. Frequent UTIs. Answer: A. Heavy postmenopausal bleeding. Question 10. A nurse is reviewing discharge instructions for a patient after laparoscopic tubal ligation. What should she include? A. Expect heavy vaginal bleeding. B. Avoid showering for 7 days. C. Use backup contraception for 1 week. D. Expect shoulder pain from CO2 gas. Answer: D. Expect shoulder pain from CO2 gas. Question 11. A nurse receives 4 calls. Which patient should she call back first? A. Teen with cramps post-menstruation. B. Woman with hot flashes. C. Patient with IUD reporting fever and foul discharge. D. Woman asking for pap smear schedule. Answer: C. Patient with IUD reporting fever and foul discharge. Question 12. A woman receiving chemotherapy for ovarian cancer develops a low-grade fever. What is the best action? A. Encourage fluids and rest. B. Administer antipyretic. C. Notify the provider immediately. D. Delay the next chemo session. Answer: C. Notify the provider immediately. Question 13. Which behavior indicates a need for further teaching after vaginal hysterectomy? A. I'll avoid lifting heavy objects. B. I can have sex again in a few days. C. I'll take stool softeners as prescribed. D. I'll monitor for signs of infection. Answer: B. I can have sex again in a few days. Question 14. A nurse is teaching about HPV vaccination. Which statement is correct? A. The vaccine treats existing HPV. B. It's given in 2 doses before age 15. C. It's only for females. D. It guarantees lifetime protection. Answer: B. It's given in 2 doses before age 15. Question 15. Which finding is most concerning in a post-op patient after gynecologic laparoscopic surgery? A. Shoulder pain. B. Mild bloating. C. No urine output for 6 hours. D. Sore throat. Answer: C. No urine output for 6 hours. Question 16. Which of the following patients is at highest risk for developing endometrial cancer? A. Woman on birth control. B. Postmenopausal woman with obesity. C. Young woman with irregular periods. D. Perimenopausal woman with hot flashes. Answer: B. Postmenopausal woman with obesity. Question 17. What's the nurse's priority when caring for a patient after dilation and evacuation D&E? A. Encourage fluids. B. Monitor for excessive bleeding. C. Assess emotional support system. D. Provide warm blankets. Answer: B. Monitor for excessive bleeding. Question 18. A patient undergoing hormone therapy asks, "Why do I need routine mammograms?" What's the best reply? A. Hormone therapy increases breast cancer risk. B. It helps regulate your hormone levels. C. Your doctor requires it for insurance. D. To check bone density. Answer: A. Hormone therapy increases breast cancer risk. Question 19. What instruction is most important for a patient prescribed clomiphene for infertility? A. Expect weight gain. B. Use condoms during therapy. C. Track ovulation for timing intercourse. D. Take it with food to prevent ulcers. Answer: C. Track ovulation for timing intercourse. Question 20. A patient with a Bartholin gland cyst reports pain and fever. What is the nurse's priority action? A. Apply ice packs. B. Prepare for incision and drainage. C. Reassure and monitor. D. Provide antibiotics at home. Answer: B. Prepare for incision and drainage. Question 21. A nurse is assessing a post-op hysterectomy patient with 38.5 degrees Celsius fever, tachycardia, and abdominal pain. What should the nurse do first? A. Administer acetaminophen. B. Encourage deep breathing. C. Notify the healthcare provider. D. Increase oral fluids. Answer: C. Notify the healthcare provider. Question 22. Which patient statement after uterine fibroid diagnosis requires further teaching? A. I may experience heavy menstrual bleeding. B. Fibroids can increase my risk of infertility. C. These are cancerous tumors. D. I might need surgery if they grow. Answer: C. These are cancerous tumors. Question 23. What action is priority for the nurse caring for a post-op gynecology patient with unilateral leg swelling? A. Measure calf circumference. B. Elevate the leg and apply ice. C. Document the finding as expected. D. Encourage early ambulation. Answer: A. Measure calf circumference. Question 24. A nurse is providing teaching after an abdominal hysterectomy. What instruction is most important? A. Avoid driving for 3 days. B. You may resume sexual activity in 1 week. C. Report fever or foul-smelling discharge. D. Climb stairs slowly to regain strength. Answer: C. Report fever or foul-smelling discharge. Question 25. Which task is appropriate for the RN to delegate to a licensed practical nurse, LPN, on a gynecology floor? A. Perform initial admission assessment. B. Educate on post-op activity restrictions. C. Monitor post-hysterectomy vital signs. D. Provide discharge instructions. Answer: C. Monitor post-hysterectomy vital signs. Question 26. Which finding in a post-op gynecology patient indicates possible bladder injury? A. Burning sensation with urination. B. No urine output despite adequate fluids. C. Cloudy urine. D. Dark amber urine. Answer: B. No urine output despite adequate fluids. Question 27. A nurse is reviewing risk factors for cervical cancer. Which history item is most significant? A. 2-term pregnancies. B. Long-term oral contraceptive use. C. Early onset of sexual activity. D. Irregular menstrual cycles. Answer: C. Early onset of sexual activity. Question 28. A nurse is preparing a patient for transvaginal ultrasound. What should the nurse do first? A. Instruct the patient to void. B. Administer an enema. C. Place the patient in supine position. D. Insert a urinary catheter. Answer: A. Instruct the patient to void. Question 29. A woman recovering from a cone biopsy asks about signs of complications. What should the nurse include? A. Mild spotting is expected. B. Call if you have foul-smelling discharge. C. Pain should last for 1 week. D. Cramping will continue for several days. Answer: B. Call if you have foul-smelling discharge. Question 30. Which assessment finding in a woman with a molar pregnancy requires urgent follow-up? A. Nausea and vomiting. B. Vaginal bleeding. C. Enlarged uterus not matching gestational age. D. Sudden shortness of breath. Answer: D. Sudden shortness of breath. Question 31. What is the best nursing intervention for a perimenopausal woman reporting hot flashes? A. Recommend high-fat meals. B. Encourage caffeine intake. C. Suggest dressing in light layers. D. Encourage alcohol to aid relaxation. Answer: C. Suggest dressing in light layers. Question 32. A nurse is caring for a patient with pelvic inflammatory disease, PID. Which finding warrants immediate action? A. Fever of 38 degrees Celsius. B. Lower abdominal pain. C. Foul vaginal discharge. D. Signs of peritonitis. Answer: D. Signs of peritonitis. Question 33. A patient with ovarian cancer asks why she needs regular CA 125 tests. What is the best explanation? A. It checks your iron levels. B. It measures infection in your ovaries. C. It helps monitor cancer progression or recurrence. D. It replaces imaging scans. Answer: C. It helps monitor cancer progression or recurrence. Question 34. A nurse teaching a group about contraceptive options should include which point about the copper IUD? A. It must be changed every year. B. It prevents pregnancy and STIs. C. It can cause heavier menstrual bleeding. D. It requires daily hormone intake. Answer: C. It can cause heavier menstrual bleeding. Question 35. Which post-op assessment finding indicates the patient is ready for discharge after laparoscopic gynecologic surgery? A. Stable vital signs and tolerating fluids. B. Mild pain and somnolence. C. Urinary output of 100 milliliters in 12 hours. D. Nausea with clear liquids. Answer. A. Stable vital signs and tolerating fluids. Question 36. Which lab result in a patient with abnormal vaginal bleeding should be reported immediately? A. Hemoglobin 11G/DL. B. Hematocrit 32%. C. Platelets 75,000/mm superscript 3. D. WBC 9,000/mm superscript 3. Answer. C. Platelets 75,000/mm superscript 3. Question 37. A nurse is educating a patient about pelvic floor therapy. Which statement indicates understanding? A. It will help reduce my hot flashes. B. It can help prevent urinary incontinence. C. It eliminates the need for surgery. D. It's only for postpartum women. Answer. B. It can help prevent urinary incontinence. Question 38. A nurse is caring for a patient with endometriosis. Which symptom is most characteristic? A. Heavy bleeding postmenopause. B. Painful menstruation and infertility. C. Chronic pelvic infections. D. Absent menstrual cycles. Answer. B. Painful menstruation and infertility. Question 39. A gynecology patient reports sudden, sharp pelvic pain while exercising. What condition is most likely? A. Endometriosis. B. Ovarian torsion. C. Cervicitis. D. Bacterial vaginosis. Answer. B. Ovarian torsion. Question 40. A nurse is reviewing care for a patient undergoing endometrial ablation. Which instruction is most important? A. Avoid NSAIDs for 3 days. B. You can resume sex within 24 hours. C. Expect light bleeding for several days. D. Take antibiotics daily for a week. Answer. C. Expect light bleeding for several days. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.